Hi Docplexus listeners, today I'm here to tell you something about the venous system that has become the next frontier as far as the vascular system is concerned. I'm Dr. Malay Patel from Ahmedabad, and I have been the founding president of the Venous Association of India, and we founded this in 2007. Reason being that at that time we as vascular surgeons started to know that the veins were as important as the arteries, probably more so, and I'll tell you why. Veins form a two-tiered system in the body. For practical purposes, they are the superficial and deep venous system, but this is maybe just true for the extremities. Most of the body has this system categorized for sake of convenience, but they all interconnect. In the abdomen, you have the portal venous system and the splanchnic venous system. So again, though both are deep venous systems, they have different roles, different areas of drainage, different things to do. Any part of the body that has a blood supply, which is primarily fed by an artery or an arteriole, has to have an equivalent drainage. Once drainage suffers, you all know congestion is what follows. And now congestion is not very bad, but it is bad in the long run, and I'll tell you why. Congestion means that the exchange of essential nutrients decreases. Many parts of the body do not have a direct blood supply of their own. And when I mean blood supply, it means an artery that feeds it and a vein that drains it. So many structures of the body, like the cartilage, the ends of the bones, the ligaments, parts of a muscle, the aponeurosis, so many structures which are required for day-to-day mobility, normal living, rely upon diffusion as a source of nutrition. Now when you have venous congestion, this diffusion from the arterial side slows down a bit. Now this is not perceptible to measuring devices. What happens is that the nutrition of that part starts to suffer when you have venous congestion. I'll give you a simple example. You have a water supply, you have a faucet that's now open, pouring water into your wash basin. But if the drainage is not good enough, water starts backing up, and then there comes a point where you have to start decreasing the water supply. Now that's not a good situation to have in most parts of the body, but the body has different mechanisms of dealing with it, and so you do not see the effects of this congestion for quite some time. It is my firm belief that early degeneration of joints, and by early I mean something that occurs over a few decades, probably takes less than or half of that time, is due to congestion of different parts of the body, and we have started to recognize a condition known as phlebarthrosis. This especially affects the knee joint, and we are seeing an aging population which is affected by osteoarthrosis of the knee joint. This is creating a good situation or a good scenario for knee joint replacements, but if the venous congestion is picked up earlier, then we may be able to save a lot of these knee joint being replaced, and there could be other ways in which the knee joints could be repaired or allowed to heal on their own. This is just one example. We see patients day in, day out who, upon being treated for superficial venous reflux, start feeling much better, their energy level increases, and all this is because venous congestion was relieved. I am of the firm opinion that such mechanisms occur in every part of the body, and this is what the next 2 or 3 decades is going to reveal. Thank you very much for listening to me and listening and trying to understand why the venous system of the body is so important. Cinderella of the body, or the vascular system, Cinderella has now come to the ball. Thank you.